All right, today we're going to show you some details about the musculature of the anterior abdominal wall. I'd like to orient you so you'll know where we are. The head of the patient is in this direction. The foot of the patient is in this direction. This is the xiphoid process. This is the symphysis pubis. We have lines drawn on the costal margins right and left, and marking lines drawn on the area of the inguinal ligament left and right. This is the midline of the abdomen where the linea alba would be. And we're going to start by showing you the abdominal musculature through two standard incisions. The first is going to be a right subcostal incision, which is one that would typically be used for gallbladder surgery or perhaps surgery for a bleeding duodenal ulcer. And that typically is done about 2 finger breadths below the costal margin. Typically, we'd make a rather short incision, something like this, but in a cadaver, because the tissues are so thick, I'm going to extend it from the midline to about the anterior abdominal line, anterior axillary line. Then we're going to go layer by layer and expose to you and show you the muscular layers of the upper abdomen. So we'll start in the midline. And I'll make my incision through the skin, extending toward the anterior axillary line. I'll pull it apart a bit as I deepen the incisions. I use what's called a rake retractor, which will provide a little additional exposure. Since I don't have a first assistant, as you can see, this is the fatty layer of the abdominal wall, sometimes referred to as Camper's fascia. In the upper abdomen, the Scarpa's fascia is not well developed, but in the lower abdomen, you may well see a very well developed membranous line here called Scarpa's fascia. Let's deepen this through the subcutaneous tissue. And as we go a little deeper, you can see that the fascia, or the external oblique aponeurosis, is coming into view. See this white shiny tissue here? That's the aponeurosis of the external oblique muscle. And as you approach the midline, we get into what's called the anterior rectus sheath. And I'm going to just expose that a little bit more in all directions, kind of trying to stay superficial to the fascia and the aponeurosis so that I can show it to you a little better. I've got that pretty well exposed, so now we're going to deepen the incision through the fascial layers, and you'll see the muscle fibers. We're going through anterior rectus sheath, and as I go beyond rectus muscle, we'll be showing you the oblique muscles. Let me get a pair of pickups and see if I can show you that a little better. You can see beneath this fascia is the musculature. This is the rectus muscle. You'll recognize it because the fibers go straight up and down. I don't know how well you can see that, but the fibers are oriented in this direction. As we go a little bit further lateral, you're going to see that the direction of the muscle fibers will change. And as we get out here, we're still on the aponeurosis of the external oblique. And you'll be able to see that the muscle fibers now are going in a different direction. Well, I'm going to go on through, all the way through the muscles so I can show you the fascial layers sort of en face. So we're going down through rectus muscle, which is usually a pretty substantial muscle, through external oblique, I'm going to try to get all the way down into the abdomen so I can show you the full thickness of the abdominal musculature. Let's see if I can show you that. I'm now all the way through the abdominal wall into the abdomen. Let me extend it with the scissors a bit. Let's see if I can pull this up to show you. So here we have the aponeurosis of external oblique that's continued anteriorly across over the rectus muscle as part of the anterior rectus sheath. The next layer down is internal oblique muscle. These fibers are oriented more in this direction, and at some point we'll see this is the aponeurosis here. The aponeurosis splits, and you can see part of the aponeurosis goes anterior to rectus muscle, part of the aponeurosis goes posterior to rectus muscle. So the fibers of the internal oblique aponeurosis split like this. The anterior fibers form part of the anterior rectus sheath. The posterior fibers form part of the posterior rectus sheath. And deep to that is the transversus abdominis muscle. So here we have doesn't have a very well developed transversus abdominal muscle. Here it is right here. It's just this filmy little thing right here. This is transversus abdominis muscle, and the fibers extend in that direction. And the entire muscle passes posterior to the rectus muscle along with its fibrous aponeurosis to form the posterior rectus sheath. So that would be a right subcostal or Coker incision that exposes all layers of the abdominal musculature.